This midday, we're joined now by Dr. Thomas Schmitz, and we are here to talk about a very important month. September is Prostate Cancer Awareness Month. Thank you for joining us this afternoon.
Absolutely. I just want to kind of get the word out about just having guys remind them about the screening for prostate cancer. It used to be that the American Cancer Society recommended nearly every guy 50 and older would get their PSAs checked and so forth, but now they first of all, as of last year, they kind of emphasized that just to make sure a guy, in all likelihood, has about a 10-year life expectancy. Even for somebody 75, there's about a 10-year life expectancy. But you know, I know old 50-year-olds and young 80-year-olds, and so it's kind of an individual thing. But even at that, generally starting at age 50, just to have guys discuss with their healthcare provider about having a PSA and digital rectal exam of the prostate checked. That there's always pros and cons of having all that done, but intuitively, you just know that the earlier something is caught, better likelihood of getting it successfully taken care of, more options for possible treatment. I see examples every day of guys not quite getting it caught early enough, and that PSA, it's a blood test whose normal range is 0 to 4, and if it's less than 2.5, they say that you can maybe get by every other year having the PSA checked. And even if you do have a normal PSA checked, it doesn't mean you're totally out of the woods, because they do follow them yearly to make sure they're not going up quickly.
Gotcha.
Because even if it's in the normal range 0 to 4, it still could be a cancer issue if it's going up quickly.
Now, let's say that a guy has history of prostate cancer in the family. Should they maybe check earlier than 50?
Absolutely. If a guy has a dad, a brother who's had prostate cancer, particularly before age 65, maybe that screening process might need to start at age 45. If there are multiple family members, maybe even starting at age 40. African American men have a higher risk of prostate cancer, and so they might need to have it checked starting at age 40 or 45, so great question.
And if we want to learn maybe some more of the signs, symptoms, that kind of thing, are there any good places that we can go to learn more?
Gosh, the American Cancer Society has an excellent website, www.cancer.org. A lot of the main institutions across the country, Mayo Clinic, National Cancer Institute, MD Anderson, a number of them, and then also at the Paul Stephen Morgan Cancer Center where I work, be able to find some information. I think we've got some numbers.
We have it right there on the screen, and thank you so much. And again, we want to stress prevention is key, and this is why you're here, so thank you.
Indeed. Thanks, Abby.
And again, if you have any more questions, you can contact the Paul Stephen Morgan Cancer Center, and there is a phone number and a website. You're watching News 10 at Midday. We'll be right back.